Hello, and welcome to celiac.com news. Subscribe to our channel to get the latest celiac disease and gluten-free diet news. And if you have any questions, be sure to join the celiac.com forum online at celiac.com. And now, let's move on to the latest celiac.com news. Gluten-free food share addresses a growing need in Canada. Across many communities, food assistance programs work hard to stretch limited supplies, but people who must avoid gluten often leave with bags full of items they can't safely eat. For those living with celiac disease or strict gluten intolerance, making do isn't possible. Even trace gluten can cause serious harm. Over the summer, a congregation in Nova Scotia tested a simple but powerful idea, a food share designed specifically for gluten-free needs. Operating under the Salvation Army's Encounter Church, the gluten-free food share serves Sackville, Bedford, and Dartmouth residents through a small market setup where guests select their own safe foods instead of receiving a generic box. The program runs twice a month and functions like a mini grocery store. Guests book time slots, shop for clearly labeled gluten-free items, and receive guidance from trained volunteers who prevent cross-contact and answer ingredient questions. The project emerged after local partners noted that standard donations rarely included gluten-free staples. With support from Food Banks Canada and help from the church's community team, volunteers now stock and organize shelves so that guests can shop confidently. At first, only a few households visited, but word spread quickly. Within weeks, participation nearly tripled and continues to grow as more people learn that the market offers real choice. Families describe the difference as life-changing. Having a basket full of safe foods instead of one or two expensive items lets them plan full meals and stretch budgets without risk. For people with celiac disease, a gluten-free diet is not optional. It's the only treatment. Yet gluten-free products are costly and rarely appear in food donations. A program that removes both cost and availability barriers does more than fill pantries. It lowers stress, reduces accidental gluten exposure, and restores dignity. Guests can plan breakfasts, school lunches, and dinners safely, avoiding skipped meals or unsafe substitutions. Those with gluten sensitivity also report steadier energy and fewer symptoms. Several design choices drive the program's success. The shopping model respects dignity and minimizes waste. Clear labeling makes selection easy, and the appointment system keeps visits calm and predictable. Regular scheduling helps families plan ahead, turning food aid into a dependable part of life. The program also improves health equity. Access to safe staples reduces emergency visits caused by accidental gluten intake and helps households stay on stable work and school schedules. Still, specialized food shares face real challenges. Gluten-free products cost more, storage needs vary, and volunteer coordination is constant. To sustain operations beyond the pilot, organizers need steady funding, proper storage, and a trained volunteer base. Donors can help by providing clearly marked gluten-free foods, grocery gift cards, or funds for staples like pasta, oats, baking mixes, and crackers. Restaurants or bakeries with certified gluten-free lines can donate surplus goods, and community groups can sponsor shop days that cover a single event's costs. A separate gluten-free track isn't redundant. It solves persistent problems. It prevents cross-contamination, allows staff to specialize in labeling and certification, and sends an important message. People with celiac disease are not an afterthought, but an expected part of the community. That inclusion encourages people to seek help before reaching crisis points. The Halifax area pilot proves how quickly a focused idea can scale. Smaller towns might hold monthly pop-ups, while cities could add dedicated gluten-free sections in existing food hubs. Partnerships matter. Clinics can refer newly diagnosed patients, schools can identify families in need, and local groups can organize targeted drives. Donors and volunteers who understand gluten-free labeling and logistics make an especially big impact. Guests can also prepare by bringing shopping lists and meal plans to prioritize what's most useful. Asking about storage can make items last longer. Gluten-free bread freezes well, baking mixes can be divided, and certified oats have multiple uses. Those managing other restrictions, like dairy avoidance, can talk with staff in advance to find suitable alternatives. The Nova Scotia initiative offers a glimpse of broader food security that truly includes everyone. When support is designed around those with the strictest dietary needs, the whole system improves. Clearer labels, calmer shopping, less waste, and greater dignity. It reframes assistance as partnership rather than charity, building trust and sustainability. Programs like this sit at the intersection of health and social care, showing how modest, targeted investments can prevent costly medical complications and strengthen families. The gluten-free food share launched by Encounter Church may be small, but its impact is wide. By centering people who must avoid gluten, it transforms food assistance into a safe, predictable, and respectful experience. For those with celiac disease or gluten sensitivity, it means fewer sacrifices and more healing meals. And for other communities across Canada, it offers a model worth replicating. Listen to people's real needs, organize around safety and dignity, and build partnerships that keep everyone fed and included. To get the latest celiac disease news and information, be sure to subscribe to celiac.com news. Thank you for tuning in and see you next time.